My name is Brooke EK, and I'm here at the University of Washington, and I have been a practice facilitator of the 6 building blocks of primary care clinics for the last 6 years, and was one of the people who put together all of the tools and resources that you guys will be engaging with in the program itself. I'm going to be talking about a building block that many of you referenced when we were talking about leadership and consensus, when you're talking about your policies. So this building block is all about putting together policies, patient agreements, and workflows.
What is the philosophy that the 6 building blocks has around this building block? We really see this as sort of a cornerstone to this work, in that these documents really provide the foundation for everything that's going to be happening at the primary care clinic, and really engage with the systems that will support and make doing this work easier. So we see policies as really a document that is an opportunity to create a shared understanding and agreed upon standards at the clinic. So this is when we were talking earlier that it really helps to have everybody in the room and discuss, like, what do we want? What is our approach? How do we want to keep our patients safe and healthy? And write down in a policy what that shared understanding is. Patient agreements, and we really emphasize the word agreement, as opposed to contract, they communicate risk to a patient and express to a patient what that clinic care philosophy is. Workflows, from the 6 building blocks perspective, really encourage team-based care. They are documents that help support how is everyone going to support each other and make this work easier. And very importantly, the policies, the agreements, and the workflows all align with one another. They're not saying different things. They are in support of one another. What are some commonly prioritized activities that clinics engage in this building block? They will take a look at their policy and then revise it to align with what the evidence-based guidelines say, and as you mentioned before, the regulations are in your state and region. They'll revise their patient agreement so that it supports what the policies say and really helps to educate patients about the risks of taking opioids and maybe also co-prescribing of benzodiazepines. And they'll write workflows that will support the policies, and then find a way to roll out and train on all of these new approaches in a way that is supportive of not overwhelming the clinic and helping them really figure out what it is that has been agreed upon. One story that was a little bit alluded to in our last building block discussion is it's really not uncommon for us to go into a clinic and for them to say, yes, we have a policy. We revised it the last time the guidelines in our state changed. And you'll say, great, can you share that with us? We'd love to take a look and see if we have any ideas about how it might be improved. And then they can't find it. They have no idea where the policy even is. And that's an opportunity to realize that maybe that document isn't in use, and maybe people aren't as familiar with what is in there as you thought. So if you guys still have on your computer the website with the clinic resources, you'll see some of these under this building block. So these are resources that can really help support your work. We have a model policy that we wrote that is in alignment with the CDC guidelines and Washington state guidelines as well, that we have used in clinics. And oftentimes clinics that we work with will review this policy in their opioid improvement team, talk about it with their providers, and say, you know, with just a few tweaks, this really works for us. And they have put their own logo on the top and implemented it. Others just use it as a guide to make changes to their own policy. So that's a really useful resource. The policy checklist is a much quicker way to sort of go through and say, what are the components that we want to make sure are in our policy? We have a model patient agreement that is really patient-centered that you can take a look at, because tone is something that we really think about when we think about the patient agreement. And then we have some workflows, including chronic pain appointments and the board opioid list manager that's helping with tracking and monitoring of the data of what's going on with the patients. And we have a resource that helps with ideas about how you might roll out and train on these resources. This is from our policy checklist. So these are just components that we recommend are a part of a clinic's policy. And we're going to PDF these slides and send them to you. And you can also open the policy checklist and take a look at it yourself. But things like continuity of care, that we're not going to throw a patient out and not continue to care for them, that it addresses co-prescribing of opioids and sedatives, that use of naloxone is something that's considered. When do we want to be prescribing naloxone, et cetera. So these are sort of the components that when you're reviewing your policy, you can check and see, is this here? And in the policy checklist, it gives more details under each of these categories. How can a practice facilitator help a clinic? How can they support this work? So one of the roles is to be an investigator. Really, it's asking a lot of questions, being curious, having them do some research like, oh, you have a policy, can I see it? What currently exists? When did you create that document? How is it used? Who uses it? So really asking a lot of questions and helping them do some investigating themselves. Another important role of a practice facilitator in this work is to be another set of eyes. It's really helpful to ask to see these resources and take a look and say, is this a policy or is it a workflow? A lot of times people will send us their policy and it looks more like a workflow. So just seeing what the documents are and reflecting on if the policy, agreement, and workflow are three legs of a stool. So I worked with a clinic once who she drew a stool on her whiteboard to remind her that the policy and the agreement and the workflows all needed to align with one another, and they were all providing this foundational support for consistent care. And I loved that idea, and I've used it ever since. So really checking and seeing if those three documents align with one another. As I mentioned before, reviewing what's the tone, not just in the patient agreement, but in the policy and workflow, because this is really communicating both to your staff and patients what, you don't want them to communicate sort of an antagonistic relationship with the patients, but instead that this is really a collaborative, helpful relationship. And then reviewing the policy with that policy checklist that I mentioned, and you can highlight key areas that the clinic might be considering revising in the policy. So being a cross-pollinator of good ideas, you all are from various sites within the health system. You guys could really help one another by cross-pollinating ideas that you have working in your clinics. Other ideas is looking at the models and examples on our website. You maybe have experiences in the past from how essential workflows can be to policy implementation, and sharing stories can really help people feel motivated to write workflows and engage in using workflows. Really encouraging team-based care is knowing that this is a good idea that has worked in other clinics and we want to implement it here in our clinic. And embedding care components into the EHR templates is seen work across a lot of different clinics, that if it's right there on the screen and aligns with what's in the workflow and in the policy, it makes it a lot easier for people to remember to do the different tasks that they should be doing. Another role is to be a project manager and accountability agent. This we hear from clinics a lot, that they appreciate in engaging in work with a practice facilitator, is that they have somebody who's helping them figure out what their plan should be to make revisions and opioid management improvements, and help them stick to that plan, remind them what their plan was. It makes a big difference to have someone who is helping move the work forward and just keeping people accountable. And then in developing these steps in their action plan, helping to encourage the opioid improvement team to include representatives from across all roles in a clinic, and really make sure, as we were mentioning before, that you're getting buy-in. And part of that is just from including people in the process. And then also making sure to pilot test in smaller groups, workflows and ideas before spreading it to the larger group. And the final role I want to talk about is being sort of a therapist and a cheerleader, because this work is hard. It can be really hard, and it can take a lot longer than people expect that it will, but it's really essential. And in the end, it makes things easier. As we talked about last time, people who have engaged in this work at the end say, wow, I am not as stressed as I was before. I have a plan. I know what I'm doing. This is a lot easier. The patients are engaged. So even though the work is hard, it's worth it. So listening to people's challenges, normalizing that hiccups are okay and that just happens and it is going to take time, and celebrating success, each little success. So the example here, they wanted to build a workflow. Step one, they found a team. They found people from multiple roles that wanted to take part in this, and that's something to celebrate.